question without notice to the Minister for Health. Deputy Speaker, over the weekend we saw yet again the international media absolutely excoriate the government and the health sector, confirming that there is a health crisis in the country, Mr. Speaker. Now, we've heard the good Minister for Health provide some vapid responses on what he is doing as the Minister for Health, responsible for all health matters. But, Deputy Speaker, I rise today on behalf of mothers that have had to go through labour and maternity services on the floor of hospitals, and this has already been brought to public attention. It was brought to public attention in 2025 and yet again in 2026. Now, my question, Mr. Speaker, 3.2 billion from a historic budget was allocated to health, 3.2 billion kina in 2026. And to date, we have heard the good minister just simply say that the money hasn't reached the hospitals. The money has been squandered by the bureaucrats. This health crisis that's currently affecting the nation, Mr. Deputy Speaker, it's not by mistake, it's not by fate, it's not by happenstance. It's either because of corruption or incompetence, or both. Now the good minister has to tell the country what steps he has taken to ensure that no more mothers give birth on the floors of these hospitals, and funding directly is provided to all health facilities throughout the country, because it's a complete indictment on the government, Mr. Deputy Speaker. We don't want waffle. We want a clear answer and a solution by this minister on how he is going to absolutely address this health crisis. It's all over the news. It's all over the international media. So he has to tell the people of Papua New Guinea and this honourable House what he's doing as the person responsible for health matters. Thank you, Deputy Speaker.
To put on record, I'd like to thank the media, the international media who goes to hospitals and present the current status of hospitals. I want to thank them for exposing the current status of health in the country so that we can improve what we need to do as a government. We will not blame anyone, but I want to say that we are addressing some of these issues. I'm in the health ministry for 20 months now, 20 months after being appointed by the Prime Minister. And the reason why we're seeing these kind of issues happening is because we have established clear roles and clear delineation under the health standards to see that what must be housed by several level 6 hospital. You know, at my level 5 in provincial hospitals, now level 1, 2, 3, 4 primary health level. So PMG is supposed to serve level 6. Now funding allocated level 6. And suppose PMG is supposed to make him work, do look side long cardiac or heart services, kidney services, or cancer services, and money, and all work. But at the moment they're using this funding to look after everybody else, where some plenty old mamas have karim. And more no deliveries, where suppose you straight more lower levels of health facilities. And mama will call it a slow lapia. So I like to put on record that we like to come as long Australia government, all straight in Metoria Clinic long, must be northeast, must be northwest. As I speak, for the first time, after many years, on mama now NCD only now current baby low outside long PMH for the first time. Now only on mama can go long Metoria Clinic. Making also stop. We are now developing improving the delivery or maternity section at Ferry Hospital. Now one kind of thing we kila. Our system improving long staff. That's what we're doing at the moment. The review is the pressure of PMH. At the moment, we must straight into Central Province. We must straight quick killer. Maternity wasn't opening long 2 months ago. People are straight into Agivaru, long Kariku district. We are now improving Kerema. All of these things. Suppose you know straight in by the impact long him and affecting what is happening at PMCH. I mean, speak with the Deputy Speaker, I'm experiencing the planning time finish. And I want to say that we are doing all of these things at the lower level, even though also we are not like we are not saying that we ignore the fact that this is happening. This is happening that we are dealing with some of the things we're dealing with them. Deputy Speaker, I mean not to call some money going out of waste now squandering or you got all corruption in the health sector. I didn't say that last time. Was money gonna corruption is stop na money no use good. Mito goes suppose you got some evidence of corruption, you got system in place to deal with those corruption. We cannot ignore the corruption that's happening, but if there are some evidence of corruption, bring those reports to us, we deal with them accordingly. So the 2 million dollars money no go all provincial hospitals or PHAs, our records funding is going. And there are some areas that funding is go, but even looking more service improve too. I've visited many of our districts, our PHAs, and I'm actually not really happy with the way that all you perform. Despite the fact that record of funding. So, Mr. Deputy Speaker, just some of these things I want to say again, put on record that we are congruent. We are fully aware of what's happening in our health system. I mean, thank you again, long old media. Keep exposing us. In this crisis, whatever you call it, it's not crisis. We are building a resilient health system and we are doing these things. Thank you, Mr. Speaker.